Ever wondered what your stool says about your health? Curious about the hidden messages in your poop? You know, most people don't like talking about it, but it's something all of us do. Yes, we're talking about your stool and what it can reveal about your well-being. From color and consistency to frequency and smell, paying attention to your stool can help you identify potential issues early on. In this video, we'll explore 11 alarming things your stool might be trying to tell you about your health. So, buckle up and let's get ready to decode those bowel movements. Let's start with the basics. Stool color. Brown is the gold standard, my friends. But did you know that variations in color can signal different things going on inside your gut? For instance, bright red blood in your stool is a major red flag and shouldn't be ignored. It could indicate something serious like hemorrhoids, anal fissures, or even colorectal cancer. If your stool is black and tarry, it could be a sign of bleeding in the upper gastrointestinal tract, such as a peptic ulcer. Don't freak out if you see a little bit of green in your stool every now and then. It could just mean that your food is moving through your digestive system a bit faster than usual, or you ate a lot of green leafy vegetables. But if it persists, it's best to get it checked out. Other colors to watch out for include pale, clay-colored stool, which could indicate a problem with your liver or gallbladder, and yellow, greasy stool, which could be a sign of malabsorption issues. Your stool is like a window into your digestive system, and paying attention to its color can give you valuable clues about your health. Now that we've covered the color spectrum of stool, let's move on to another crucial aspect: consistency. The Bristol Stool Chart classifies stool into 7 different types, ranging from type 1, separate hard lumps, to type 7, watery, no solid pieces. Ideally, your stool should be somewhere between types 3 and 4, which are considered the easiest to pass. If you're experiencing type 1 or 2, it could mean you're constipated, which can be caused by dehydration, lack of fiber, or certain medications. On the other end, if your stool consistently falls under type 6 or 7, you might have diarrhea, which could be due to a viral infection, food poisoning, or digestive disorders like IBS. Consistency is key when it comes to healthy bowel movements. Pay attention to what's normal for you, and seek medical advice if you notice any significant or persistent changes. Alright, let's talk about a serious topic. Blood in your stool. Bright red blood typically indicates bleeding in the lower digestive tract, such as the rectum or anus. This could be due to conditions like hemorrhoids or anal fissures. However, it could also be a sign of something more serious like colorectal cancer. Black, tarry stools usually point to bleeding in the upper digestive tract, such as the esophagus, stomach, or small intestine. This type of bleeding could be caused by peptic ulcers, gastritis, or certain medications like aspirin or ibuprofen. Any sign of blood in your stool should never be ignored. Consult with a healthcare professional to determine the underlying cause and receive appropriate treatment. You might be surprised to learn that a small amount of mucus in your stool is completely normal. Mucus helps lubricate your digestive tract and protect it from harmful substances. However, if you notice an excessive amount of mucus in your stool, especially if it's accompanied by other symptoms like abdominal pain, diarrhea, or blood, it could be a sign of an underlying condition. One possibility is inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis. Another potential culprit is irritable bowel syndrome, a common disorder that affects the large intestine. If you're concerned about mucus in your stool, don't hesitate to reach out to your doctor. They can help determine the underlying cause and recommend appropriate treatment options. Have you ever noticed your stool stubbornly refusing to sink to the bottom of the toilet bowl? While it might seem strange, floating stool is usually nothing to worry about. In most cases, it simply means that your stool contains more gas than usual, making it less dense and more likely to float. This can happen for a variety of reasons, such as eating gas-producing foods, swallowing air while eating or drinking, or taking certain medications. If you experience persistent floating stool accompanied by other symptoms like unexplained weight loss, diarrhea, or foul-smelling stools, consult with your doctor to rule out any underlying medical conditions. Now, let's talk about another stool shape that could signal a potential problem: pencil-thin stool. As the name suggests, this type of stool is significantly narrower than usual, resembling a pencil in shape. While an occasional episode of pencil-thin stool might not be a cause for concern, persistent pencil-thin stools could indicate an underlying issue. One possibility is a blockage in the colon, which could be caused by a tumor, scar tissue, or even a buildup of stool. Another potential culprit is irritable bowel syndrome, which can affect the muscles in your colon, causing changes in stool consistency and shape. If you consistently notice pencil-thin stools, consult with your doctor to determine the underlying cause and receive appropriate treatment. Early detection is key when it comes to treating digestive issues effectively. When it comes to bowel movements, there's no magic number that applies to everyone. What's considered normal can vary widely from person to person, with some people going 3 times a day and others going 3 times a week. However, it's essential to pay attention to your own bowel habits and notice any significant changes. A sudden increase in stool frequency, especially if it's accompanied by loose, watery stools, could indicate diarrhea, which can be caused by infections, food intolerances, or digestive disorders. A decrease in stool frequency, especially if you're straining to pass hard, dry stools, could signal constipation, which can be caused by dehydration, lack of fiber, certain medications, or stress. Consistency is key when it comes to healthy bowel movements. Let's be honest, nobody expects their stool to smell like roses. However, if you notice a particularly foul or unusual odor emanating from your bowel movements, it could be a sign that something's not quite right in your digestive system. One possible culprit is malabsorption, a condition where your body isn't able to properly absorb nutrients from food. Certain infections, such as giardiasis or amoebiasis, can also cause foul-smelling stools, as can inflammatory bowel diseases like Crohn's disease and ulcerative colitis. In some cases, foul-smelling stools could also be a side effect of certain medications or a sign of a more serious medical condition. If you're concerned about the odor of your stool, don't hesitate to discuss it with your doctor. They can help determine the underlying cause and recommend appropriate treatment options. It's not uncommon to see small bits of undigested food in your stool from time to time, especially if you've eaten something particularly fibrous like corn or certain vegetables. However, if you consistently notice large amounts of undigested food in your stool, it could be a sign that your digestive system isn't breaking down food properly. One possible explanation is that you're simply not chewing your food thoroughly enough. Another possibility is that you have a digestive disorder that's interfering with your body's ability to digest food properly. If you're concerned about undigested food in your stool, consult with your doctor to rule out any underlying medical conditions and receive appropriate treatment. Digestion begins in the mouth, and chewing your food thoroughly helps break it down into smaller particles that are easier for your body to digest. Oily or greasy stool, also known as steatorrhea, is characterized by stools that are pale, bulky, and foul-smelling. This type of stool indicates that your body isn't properly absorbing fats from your diet. One of the most common causes of oily stool is pancreatic insufficiency, a condition where your pancreas doesn't produce enough digestive enzymes to break down fats. Other potential causes of oily stool include celiac disease, an autoimmune disorder triggered by gluten consumption, and short bowel syndrome, a condition where a significant portion of the small intestine is missing or has been surgically removed. In these cases, the body's ability to absorb nutrients, including fats, is compromised. If you experience persistent oily or greasy stools, consult with your doctor to determine the underlying cause and receive appropriate treatment. The pancreas plays a crucial role in digestion, producing enzymes that help break down fats, proteins, and carbohydrates. We've talked about black or tarry stools before, but let's delve a little deeper into what can cause this alarming symptom. Black or tarry stools, medically known as melena, often indicate bleeding in the upper gastrointestinal tract, which includes the esophagus, stomach, and duodenum. This type of bleeding can be caused by peptic ulcers, gastritis, and esophageal varices. Certain medications such as aspirin, ibuprofen, and other non-steroidal anti-inflammatory drugs can also increase the risk of bleeding in the upper gastrointestinal tract. If you notice black or tarry stools, seek medical attention immediately to determine the underlying cause and receive appropriate treatment. Thanks for watching. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more health tips. And be sure to share this video with your friends and family. You might just help someone become more aware of their digestive health. Until next time, stay healthy and keep those bowels moving. Don't forget to subscribe for more health tips.